You wake up in the morning, and before your feet even hit the floor, you feel it. That dull, nagging ache in your lower back. You try to stand up straight, but your body resists. You take a few steps, and every movement reminds you that something isn't right. Sound familiar? You're not alone. Right now, over 80% of people will experience lower back pain at some point in their lives. It's the leading cause of disability worldwide, costing billions in medical expenses and lost productivity. But here's the truth nobody wants to tell you. Most lower back pain isn't a life sentence. It's a wake-up call. And today, we're going to decode exactly what your back is trying to tell you, why traditional treatments often fail, and what actually works to get you back to living pain-free. Let's start with a story. Imagine Sarah. She's 35, works a desk job, has 2 kids, and used to love going for runs on the weekend. But 6 months ago, she bent down to pick up a laundry basket, and something in her lower back just gave out. The pain was instant and excruciating. She couldn't stand up straight for 3 days. She went to the doctor, got some painkillers, was told to rest, and that it would get better. Weeks turned into months. The sharp pain became a constant, dull ache. She stopped running. She stopped playing with her kids on the floor. She became irritable, gained weight, and her whole life seemed to revolve around managing this pain. Does this sound like someone you know? Maybe it sounds like you. Lower back pain is one of those conditions that everyone experiences, yet nobody truly understands. We live in a world where we can split atoms, send rovers to Mars, and perform heart transplants, but we still struggle to fix a bad back. Why? Because lower back pain isn't just one thing. It's a complex puzzle involving bones, muscles, nerves, ligaments, discs, and even your brain's perception of pain. And most importantly, it's deeply connected to how you live your life every single day. Let's break down what's actually happening in your lower back when pain strikes. Your lower back, or lumbar spine, consists of 5 vertebrae labeled L1 through L5. These bones are stacked on top of each other with cushioning discs in between, held together by ligaments, and surrounded by muscles that provide support and enable movement. This structure bears the weight of your entire upper body and serves as the pivot point for almost every movement you make. When you bend over, twist, lift something, or even just sit down, your lower back is working. Now, here's where things get interesting. Most lower back pain doesn't come from a single catastrophic injury. Sure, you can herniate a disc by lifting something too heavy with poor form, but that's actually pretty rare. The vast majority of lower back pain develops gradually over time due to cumulative stress, poor posture, weak muscles, and movement patterns that your spine simply wasn't designed to handle repeatedly. Think about how you spend your day. If you're like most people, you probably sit for hours at a time. Maybe you're hunched over a computer, slouching on a couch, or craning your neck to look at your phone. Studies show that sitting puts up to 40% more pressure on your lower back discs than standing does. When you sit with poor posture, that pressure can increase even more. Over weeks, months, and years, this constant stress causes the discs to degenerate, muscles to weaken and tighten in all the wrong places, and inflammation to build up in the surrounding tissues. But sitting isn't the only culprit. Modern life has made us sedentary in ways our ancestors never experienced. We don't walk as much. We don't squat. We don't move through full ranges of motion. Our hip flexors become tight and short from constant sitting. Our glutes, which should be powerful stabilizers for our spine, become weak and inactive. Our core muscles, which should act like a natural back brace, lose their strength and coordination. And when all of these support systems fail, guess what takes up the slack? Your lower back. And it simply wasn't designed to do all that work alone. Let's talk about the most common specific causes of lower back pain. First up, muscle strains and ligament sprains. This is what happens when you make a sudden movement, lift something awkwardly, or push your body beyond what it's currently capable of handling. The muscles and ligaments that support your spine get overstretched or torn. The result is inflammation, muscle spasms, and pain that can range from mild discomfort to completely debilitating agony. The good news? This type of pain usually heals on its own within a few weeks with proper care. Then we have disc problems. Between each vertebra in your spine is a cushioning disc made of a tough outer layer and a gel-like center. When these discs degenerate over time, they can bulge or herniate, meaning the inner gel pushes out through a tear in the outer layer. If this bulge presses on a nerve, you can experience not just back pain, but also shooting pain down your leg, numbness, tingling, or weakness. This is called sciatica, and it's one of the most miserable experiences a person can have. Facet joint dysfunction is another major player in back pain. The facet joints are small joints at each level of your spine that allow for movement and provide stability. When these joints become inflamed or degenerate due to arthritis, they can cause significant pain, especially with certain movements like twisting or bending backward. This type of pain often feels worse in the morning and improves with movement throughout the day. Spinal stenosis is a condition where the spaces within your spine narrow, putting pressure on the nerves that travel through the spine. This is more common as we age and can cause pain, numbness, and weakness, particularly when standing or walking. People with spinal stenosis often feel better when they sit or lean forward, which temporarily opens up those narrowed spaces. Spondylolisthesis is another condition worth understanding. This occurs when one vertebra slips forward over the one below it. This can happen due to degenerative changes, stress fractures, or congenital defects. When this happens, it can compress nerves and cause significant pain and dysfunction. And then there's the elephant in the room that many doctors are finally starting to acknowledge: chronic pain that persists even after the original injury has healed. This is where things get really complex because pain isn't just about tissue damage. Your brain and nervous system play a huge role in how you experience pain. Sometimes the nervous system becomes sensitized, essentially getting stuck in a state of high alert where it interprets normal sensations as pain. This is why some people continue to suffer long after their MRI shows that everything has healed. Now, let's address something crucial that most people don't understand. An MRI of your lower back will almost certainly show something abnormal. Bulging discs, degenerative changes, arthritis. These things are incredibly common even in people who have zero pain. Studies have shown that if you take 100 people with no back pain and give them all MRIs, more than half will have disc bulges or other abnormalities. So just because your MRI shows a problem doesn't mean that's what's causing your pain. This is why the most expensive imaging technology in the world often fails to solve the mystery of back pain. So what actually works? Let's start with what doesn't work, or at least doesn't work as well as we once thought. Extended bed rest used to be the standard recommendation for back pain. Now, we know that prolonged inactivity actually makes things worse. Your muscles weaken, your joints stiffen, and your pain often intensifies. Similarly, passive treatments like massage, heat therapy, and chiropractic adjustments can provide temporary relief, but they don't address the underlying causes of your pain. They feel good in the moment, but if you're not also working to strengthen your body and change your movement patterns, you'll be back on that treatment table week after week. Surgery is sometimes necessary, particularly for cases involving severe nerve compression or spinal instability, but it should be a last resort. Many back surgeries have disappointing long-term outcomes, and some people end up in more pain after surgery than they were before. The problem is that surgery can fix a structural issue but can't fix weak muscles, poor movement patterns, or a sensitized nervous system. So what does work? The answer is probably less exciting than you hoped for, but it's also incredibly empowering. The most effective treatment for most lower back pain is movement, strengthening, and education. Let me say that again because it's so important. The best medicine for your back is learning to move well and building a body that's strong enough to support itself. Core strengthening is absolutely essential, but when I say core, I don't mean doing 100 crunches a day. Your core includes all the muscles that stabilize your spine and pelvis, including your deep abdominal muscles, back muscles, pelvic floor, and diaphragm. These muscles need to work together in a coordinated way to support your spine during movement. Exercises like planks, dead bugs, bird dogs, and Pallof presses are far more effective than traditional sit-ups for building real functional core strength. Let me break down some specific exercises that can transform your back health. The plank is a foundational exercise that teaches your entire core to work as a unit. Start on your forearms and toes, keeping your body in a straight line from head to heels. The key is not how long you can hold it, but how well you can maintain proper form. Start with 20 to 30 seconds and focus on keeping your core tight, your glutes engaged, and your breathing steady. As you get stronger, you can progress to side planks, which target the often neglected oblique muscles that play a crucial role in spinal stability. The dead bug exercise is brilliant for teaching core control and coordination. Lie on your back with your arms extended toward the ceiling and your knees bent at 90 degrees. Slowly lower one arm overhead while extending the opposite leg, keeping your lower back pressed to the floor. Return to the starting position and repeat on the other side. This exercise teaches your core to maintain stability while your limbs are moving, which is exactly what it needs to do in real life. Bird dogs are another essential movement. Start on your hands and knees, then extend one arm forward and the opposite leg back, forming a straight line from fingertips to toes. Hold for a few seconds, then return to the starting position and switch sides. This exercise builds balance, coordination, and the kind of stability your spine needs during everyday activities. The key is to move slowly and with control, not to rush through repetitions. Hip mobility and glute strength are equally important. Remember how I mentioned that tight hip flexors and weak glutes contribute to back pain? We need to reverse that. The hip flexors are a group of muscles at the front of your hip that become chronically shortened when you sit for long periods. When these muscles are tight, they pull on your pelvis and create an excessive arch in your lower back, which increases stress on your lumbar spine. The classic hip flexor stretch is simple but effective. Kneel on one knee with the other foot planted in front of you. Gently push your hips forward while keeping your torso upright until you feel a stretch in the front of the hip on your kneeling side. Hold for 30 to 60 seconds and repeat on the other side. Do this several times throughout the day, especially if you've been sitting for extended periods. Your glutes are among the most powerful muscles in your body, and they're supposed to be the primary drivers of hip extension and stabilizers for your pelvis and spine. But for most people, these muscles have essentially gone to sleep. Glute bridges are the perfect wake-up call. Lie on your back with your knees bent and feet flat on the floor. Push through your heels to lift your hips toward the ceiling, squeezing your glutes at the top. Lower back down with control and repeat for 15 to 20 repetitions. Make sure you're feeling this in your glutes, not your hamstrings or lower back. Single-leg glute bridges take this exercise to the next level by adding a stability challenge. Clamshells are another excellent glute exercise. Lie on your side with your knees bent and stacked on top of each other. Keeping your feet together, lift your top knee as high as you can while maintaining contact between your feet. This targets the gluteus medius, a crucial stabilizer that prevents your pelvis from dropping when you walk or stand on one leg. Squats are often called the king of exercises, and for good reason. They build strength throughout your entire lower body while teaching you proper movement mechanics. The key to a back-friendly squat is pushing your hips back as if you're sitting into a chair, keeping your chest up and your weight in your heels. Your knees should track over your toes but not extend far past them. Start with bodyweight squats, focusing on perfect form, then gradually add resistance as you get stronger. Proper lifting mechanics are something everyone should learn, but almost nobody does. When you need to pick something up off the ground, you should hinge at your hips, keep your back neutral, engage your core, and use your leg muscles to do the lifting. Most people bend at their lower back and wonder why they throw it out lifting a bag of groceries. Practice the hip hinge movement pattern without any weight first. Stand with your feet hip-width apart, place your hands on your thighs, and push your hips back as far as you can while keeping your spine neutral. You should feel a stretch in your hamstrings. This is the foundational movement pattern for safe lifting. Walking is one of the most underrated treatments for back pain. It's low impact, promotes blood flow to your spine, keeps your joints mobile, and strengthens the muscles that support your back. If you're dealing with back pain, one of the best things you can do is go for a walk every day. Start with whatever distance feels manageable, even if it's just 5 minutes, and gradually build up. The key is consistency, not intensity. A 20-minute walk every day is infinitely better than an hour-long walk once a week. Swimming and water exercises are particularly beneficial for people with back pain because the buoyancy of water supports your body weight and reduces stress on your joints and spine. The resistance of water also provides a gentle strengthening stimulus without the impact of land-based exercises. Even just walking in chest-deep water can be therapeutic. Let's talk about the mental and emotional side of pain because this is where things get really interesting. Stress, anxiety, and depression don't just make pain worse. They can actually cause physical tension and inflammation in your body. When you're stressed, your muscles tense up, your breathing becomes shallow, and your nervous system stays in a heightened state of alert. All of this creates the perfect environment for pain to thrive. This is why mind-body approaches like meditation, deep breathing exercises, cognitive behavioral therapy, and even journaling can be powerful tools for managing chronic back pain. The relationship between stress and back pain is bidirectional. Pain causes stress, and stress amplifies pain, creating a vicious cycle that can be hard to break. Learning to manage your stress isn't just good for your mental health, it's essential for your physical recovery. Deep breathing exercises activate your parasympathetic nervous system, which is responsible for rest and recovery. Try this simple technique. Breathe in slowly through your nose for a count of 4, hold for a count of 4, then exhale slowly through your mouth for a count of 6. The longer exhale helps activate the relaxation response. Do this for just 5 minutes a day, and you'll likely notice a difference in both your pain levels and your overall stress. Meditation doesn't have to be complicated or spiritual. At its core, it's simply the practice of paying attention to the present moment without judgment. When you're dealing with chronic pain, your mind often catastrophizes about the future or ruminate about the past. Meditation teaches you to observe your pain without getting caught up in the story about what it means. This doesn't make the pain disappear, but it can significantly reduce the suffering that often accompanies pain. Cognitive behavioral therapy has been shown in numerous studies to be highly effective for chronic pain. It works by helping you identify and change thought patterns and behaviors that contribute to your pain experience. For example, if you believe that any pain means damage and that you should avoid all activities that cause discomfort, you'll likely become more sedentary, which will ultimately make your pain worse. CBT helps you recognize these unhelpful beliefs and replace them with more accurate, adaptive ones. Sleep quality matters more than most people realize. When you don't sleep well, your body can't heal properly, your pain tolerance decreases, and inflammation increases. If you're dealing with back pain, prioritizing sleep isn't a luxury, it's a necessity. This means creating a sleep-friendly environment, maintaining a consistent sleep schedule, and yes, investing in a mattress that properly supports your spine. The ideal sleeping position for most people with back pain is on their side with a pillow between their knees, which helps keep the spine aligned and reduces stress on the lower back. If you prefer sleeping on your back, placing a pillow under your knees can help maintain the natural curve of your lower back. Stomach sleeping is generally the worst position for your spine because it forces your neck to twist and can increase the arch in your lower back. Your mattress should support the natural curves of your spine while distributing your body weight evenly. A mattress that's too soft allows your body to sink in ways that misalign your spine. A mattress that's too firm can create pressure points and doesn't accommodate the natural curves of your body. Most experts recommend replacing your mattress every 7 to 10 years, though this depends on the quality and how well you maintain it. Nutrition also plays a role. Chronic inflammation is a major contributor to pain, and your diet can either fuel that inflammation or help reduce it. Processed foods, sugar, and excessive amounts of omega-6 fatty acids promote inflammation. On the other hand, whole foods rich in omega-3 fatty acids, antioxidants, and fiber help fight inflammation. You can't outeat a bad back, but you also can't expect to heal optimally if you're fueling your body with junk. Omega-3 fatty acids, found in fatty fish like salmon, sardines, and mackerel, as well as in walnuts, flax seeds, and chia seeds, have powerful anti-inflammatory properties. Aim to include these foods in your diet several times a week. Colorful fruits and vegetables are packed with antioxidants that help combat inflammation and support overall health. Berries, leafy greens, peppers, and cruciferous vegetables like broccoli and cauliflower should be staples in your diet. Turmeric, particularly its active compound curcumin, has been shown to have significant anti-inflammatory effects. Adding turmeric to your cooking or taking a high-quality supplement can be beneficial. Ginger is another natural anti-inflammatory that can be consumed as a tea, added to meals, or taken as a supplement. Staying well hydrated is also crucial because your intervertebral discs need water to maintain their height and cushioning properties. Body weight is another factor we need to address honestly. Carrying extra weight, particularly around your midsection, puts additional stress on your lumbar spine. Every pound of excess body weight puts 4 pounds of extra pressure on your lower back. Losing even a modest amount of weight can significantly reduce back pain for many people. This isn't about judgment or aesthetics, it's simply physics and biology. The challenge is that when you're in pain, exercise becomes difficult, which can lead to weight gain, which increases pain, creating another vicious cycle. The key is to start with gentle, low-impact activities that don't aggravate your pain. Walking, water exercises, and gentle stretching are good starting points. As your pain decreases and your strength improves, you can gradually increase the intensity of your activities. Now let's talk about what to do when you're in the middle of an acute pain flare-up. Knowing how to manage these episodes can prevent them from turning into chronic problems. First, don't panic. Acute back pain is incredibly common and usually resolves within a few weeks. Ice can help reduce inflammation in the first 48 to 72 hours after an injury. Apply ice for 15 to 20 minutes at a time, several times a day. After that, heat often feels better and helps relax tight muscles. A heating pad or warm bath can provide significant relief. Gentle movement is better than complete rest. Even if it's just walking around your house or doing some very gentle stretches, keeping your body moving prevents stiffness and promotes healing. The cat-cow stretch is a gentle way to mobilize your spine. Start on your hands and knees, then slowly arch your back upward like a cat, then lower your belly and lift your chest like a cow. Move slowly and breathe deeply with each movement. Knee-to-chest stretches can help relieve tension in your lower back. Lie on your back and gently pull one knee toward your chest, holding for 20 to 30 seconds, then switch sides. You can also pull both knees to your chest simultaneously for a slightly deeper stretch. The key is to move gently and stop if anything increases your pain. Over-the-counter anti-inflammatory medications like ibuprofen can help manage pain and reduce inflammation, but they should be used judiciously and not as a long-term solution. If your pain is severe, your doctor might prescribe muscle relaxants or stronger pain medication for short-term use. The key word here is short-term. These medications can help you get through the worst of it, but they don't heal anything. When should you see a doctor? If your pain is severe and doesn't improve after a few days, if you have pain that radiates down your leg, if you experience numbness or weakness in your legs or feet, if you have loss of bladder or bowel control, or if you have unexplained weight loss or fever along with back pain, you need to get checked out. These can be signs of something more serious that requires immediate medical attention. Red flags that require immediate evaluation include sudden onset of severe pain after trauma, pain accompanied by fever or unexplained weight loss, progressive neurological symptoms like weakness or numbness that's getting worse, and cauda equina syndrome. which involves loss of bladder or bowel control and numbness in the saddle region. This last one is a medical emergency that requires immediate intervention to prevent permanent damage. For most people, though, the path forward involves working with a physical therapist who can assess your specific situation, identify muscle imbalances and movement dysfunctions, and design a personalized exercise program to address your unique needs. Physical therapy isn't just about passive treatments, it's about education and empowerment. A good physical therapist teaches you how to move better, gives you the tools to manage your pain, and helps you build a stronger, more resilient body. The initial evaluation with a physical therapist typically involves a detailed history of your pain, an assessment of your posture and movement patterns, strength testing, flexibility testing, and special tests to identify the specific structures that might be contributing to your pain. Based on this evaluation, they'll create a treatment plan tailored to your needs. This might include manual therapy techniques to improve mobility, therapeutic exercises to build strength and stability, education about pain science and self-management strategies, and gradual progression back to your normal activities. Workplace ergonomics deserve special attention because so many people spend the majority of their waking hours at a desk. Your workstation setup can either support your spine or slowly destroy it. Your monitor should be at eye level so you're not constantly looking down or up. Your chair should support the natural curve of your lower back, and your feet should rest flat on the floor or on a footrest. Your keyboard and mouse should be positioned so your elbows are at a 90-degree angle and your wrists are neutral. But even the perfect ergonomic setup isn't enough if you're sitting in it for 8 hours straight. The human body wasn't designed for prolonged static postures. Set a timer to remind yourself to stand up and move every 30 to 60 minutes. Even just standing up and doing a few gentle stretches or walking around for a couple of minutes can make a huge difference. Standing desks or sit-stand workstations can be helpful, but the key is variation. Not just standing all day instead of sitting all day. Let me share what happened to Sarah, the woman I mentioned at the beginning. After months of suffering, she finally found a physical therapist who took the time to really assess her situation. They discovered that her glutes were barely firing, her core was weak, and years of sitting had left her hip flexors incredibly tight. Her physical therapist designed a program that focused on activation exercises, progressive strengthening, and movement retraining. It wasn't glamorous, it wasn't a quick fix, but after 3 months of consistent work, Sarah was back to running. After 6 months, she was stronger than she'd been in years. The pain that had controlled her life became something that occasionally flared up, but that she knew how to manage. Sarah's recovery wasn't linear. She had setbacks. There were days when her pain flared up and she felt discouraged. But she learned that setbacks are a normal part of the healing process, not a sign of failure. She learned to listen to her body, to distinguish between discomfort that was part of getting stronger and pain that was a warning sign to back off. She learned that consistency matters more than intensity, that small daily actions compound into major changes over time. Prevention is always better than treatment. If you don't currently have back pain, consider yourself lucky and take steps to keep it that way. Build a strong foundation through regular exercise that includes both strength training and cardiovascular activity. Maintain flexibility through regular stretching or yoga. Practice good posture and body mechanics in your daily activities. Maintain a healthy body weight. Manage your stress. Get adequate sleep. These aren't complicated strategies, but they're incredibly effective. For those who do have back pain, remember that chronic doesn't mean permanent. It just means it's been going on for a while. With the right approach, most people can significantly reduce their pain and improve their function. It requires patience, consistency, and often a willingness to change habits and movement patterns that have been ingrained for years. But it's absolutely possible. That's the reality of dealing with lower back pain. It's not about finding a magic cure or a miracle treatment. It's about understanding your body, identifying what's causing your pain, and doing the consistent work to address those root causes. It's about building strength, improving mobility, managing stress, and making choices every day that support your spine rather than stress it. The truth is, your lower back is incredibly resilient. It's designed to move, to bend, to twist, to support you through all of life's activities. But like anything else, it needs to be taken care of. You wouldn't expect your car to run forever without maintenance. Why would you expect your body to? If you're dealing with lower back pain right now, I want you to know that there is hope. You are not broken. Your pain is real, but it doesn't have to be permanent. Start where you are. Maybe that means just taking a walk today. Maybe it means scheduling an appointment with a physical therapist. Maybe it means finally addressing that extra weight you've been carrying or that stress you've been ignoring. Whatever it is, take that first step. Your back has carried you through your entire life. It's supported you through every moment, every movement, every adventure. Now it's time to return the favor. Give it the strength it needs. Give it the care it deserves. And watch as your pain transforms from something that controls you into something you can control. Because at the end of the day, lower back pain isn't just about your spine. It's about your quality of life, your ability to do the things you love, and your freedom to move through the world without limitation. And that's worth fighting for.